We live now, please?
Yes, we're live.
Okay, good afternoon, everyone. Welcome to the NHS Lincolnshire Clinical Commissioning Group final annual public meeting on the 26th of September 2022. Firstly, I would like to introduce myself. I am Andrew Cash, the Lincolnshire Interim Integrated Care Board Chair. I would like to extend a warm welcome to everyone who has joined the meeting, which is being held via Microsoft Teams as a live event to enable a wider audience to be reached. A recording of this meeting will be posted on the ICB website in the next few days for those who are unable to attend in person. Can I ask that the board members remain muted and adopt the usual discipline of hands up during the meeting? It would also be helpful if board members could introduce themselves either when presenting items, asking questions, or contributing to the discussions. This annual public meeting is being held as part of the former NHS Lincolnshire Clinical Commissioning Group's statutory commitments prior to the establishment of the NHS Lincolnshire Integrated Care Board, ICB, on the 1st of July 2022. We aim to have as open and free-flowing discussion as we can, and will aim to respond to the questions received through the question and answer facility and any questions that have been submitted beforehand using the pro forma, which was made available on the Integrated Care Board website. All questions and responses will be included in the minutes from the meeting and published on the ICB website. In terms of the agenda for the meeting, this is available on the ICB website along with the associated pack of papers, which was published last week. In summary, Dr. Jerry McSorley, the former acting CCG chair, will present the minutes of the previous Lincolnshire CCG annual public meeting held in September 2021. This will be followed by a presentation by Mr. John Turner, Chief Executive, which will include a reflection on the last 18 months, the current position, and a forward look and presentation of the NHS Lincolnshire CCG annual report and accounts 2021 to 2022. The presentation slides will be made available after the meeting on the ICB website. This will then be followed by the questions and answers part of the meeting. We hope you find our annual public meeting informative, and we look forward to meeting people on a face-to-face basis going forward. Thank you. So with that, I'd like to move to item 2 of the meeting and ask Dr. Jerry McSorley, ICB Non-Executive Director and Acting Chair of the NHS Lincolnshire CCG, to present the minutes of the meeting held in September 2021. Thank you.
Thank you very much indeed, Chair. So yes, I'm Jerry McSorley. I was acting CCG Chair for NHS CCG since the end of December 2021, and I'm delighted to submit to the annual public meeting the minutes of the CCG's annual public meeting that took place on the 22nd of September 2021 and related to the annual report for the year 2021. The minutes are shown as on the website. I'd just like to touch on just the highlights, if I might, and these are shown on page 2, where we turned through a number of issues, including the vaccination programme for COVID, a review of the year 2021 in terms of the challenges and achievements that the CCG and colleague and partner organisations had undertaken, the current position and our perspective on the next 6 months, and key priorities as we move forward. We discussed those items, and we also received from the public a number of questions, and these were answered as shown in the minutes. So I'm delighted to present to the annual public meeting today those minutes dated the 22nd of September 2021. Chair, thank you.
Thank you, Dr. McSorley. That's fine. Are there any comments, please? No, and there's nothing in the meeting chat either. So, with no further ado, I'd like to move us on to item 3 of the annual public meeting, which is the Chief Executive's presentation. And I'd like to ask John Turner, Chief Executive of the NHS Lincolnshire Integrated Care Board, to make his presentation. John, thank you.
Thank you, Andrew. Thanks for passing the live feed to me, Steph. So, afternoon, everybody. I'm John Turner. I'm the Chief Executive of the NHS Lincolnshire Integrated Care Board. I've been working in Lincolnshire back in Lincolnshire for over 6 years now, and I was prior to my current role, I was the Chief Executive of the NHS Lincolnshire Clinical Commissioning Group. Jules, could I just check, please? Are my slides being shown on screen?
Hi, John. Yes, Steph was going to do those for you. There's an issue. There you go.
Oh, perfect. Thank you, Steph. So if you want to click us along a few, please, Steph. So number 5. Okay, thanks, Steph. That's great. It's currently coming up to the end of September 22. Technically, the NHS Lincolnshire Clinical Commissioning Group, this annual public meeting is for the period of 1st of April 21 to 31st of March 22. Obviously, that period ran out 6 months ago now. Subsequent to that, we've had 3 further months of the NHS Lincolnshire Clinical Commissioning Group prior to the Integrated Care Board being established from the 1st of July 2022 as part of the new national changes across the whole of the NHS in the country. So what I thought I would do is I would reflect on the totality of the last 18 months and up to date. I'd then just say a few words about the current position and the forward look. And also just to note for everybody that the annual report and accounts are already available through the link on the NHS Lincolnshire Integrated Care Board website. If you were to follow the details in relation to this meeting, the annual public meeting, you'll be able to access them there, and they will be more formally published in a couple of days' time. So, Steph, if you just pass on to the next slide, please. So clearly, over the last 18 months, it has been an extraordinary and profound time for the whole of the country, hasn't it? As I think about the last 18 months, well, 18 months ago, we were still very much in the grips of the COVID pandemic, and 12 months ago, we were just about to experience a further wave of COVID coming up through the last winter. It has been a really monumental, I think, profound time for all of us in the country. Clearly, for the population of Lincolnshire and the people we serve, there's been a significant difficulties in terms of health and care, as well as for those of us working in the health and care system in the county. I did just want to say a huge thanks to all of the CCG and now the ICB staff team who've supported me and the board and our executive leaders over the past 18 months for the excellent, absolutely excellent work. I'd also like to say a big thank you to our partners who we've worked very closely with across the health and care system in Lincolnshire, be that our GPs, our NHS Trust colleagues, our colleagues in local government and in the care and third sector. The last 18 months has, I think, seen a huge sort of Lincolnshire team effort in terms of getting us through the pandemic and out of the other side. The key highlights for me, well, there are many that are noted in the annual report, but clearly the most significant one I feel is the vaccination programme. I'm extremely proud of the vaccination programme in Lincolnshire, and huge thanks to everybody who's been involved in it. It wasn't just an NHS vaccination programme, it was a whole health and care system in Lincolnshire vaccination programme. So the volunteers who helped us with it, our third sector colleagues who helped us with it, everybody working across the care sector, both in care homes and in domiciliary care, played a really important role in it, as well as did our partners across the NHS and our GPs in particular. I'm delighted to say that right from the off, the vaccination programme in Lincolnshire was up there amongst the leading systems in the whole of the country. We had the first, on day one of the first hospital hubs for vaccinations. We in Lincolnshire had one of the hospital hubs. On day one of the mass vaccination centres, we had one of those. On day one of the PCN local centres, we had one of those. And I think that's just testament to the energy and enthusiasm of people across the NHS in Lincolnshire and our partners in terms of the vaccination programme. Our programme was and remains one of the best in the country. And interestingly, I've just been looking at the booster programme that is currently just started, and again we've got off to a great start in Lincolnshire with that. Clearly the last 18 months, as well as we've been dealing with the impact of COVID in the vaccination programme, we've all been working really hard across our health system in terms of fully restoring NHS services. And again, I pay tribute to everybody across primary care, mental health, our community health services, as well as our hospital services in terms of their input and contribution to that. I must say that excellent progress has been made, for example, in the area of operations and elective care, but also across cancer, across mental health, learning disability and autism, children and young people and primary care. A vast amount of work has taken place. So there is excellent progress on catch up, but I think it's only right to note, and I'll come on to it in a few moments time, just how much more work there is that lies ahead of us in that. Next slide, please, Steph. Thank you. As I've indicated, not only has a huge amount of work been done on vaccinations and recovery and restoring our services, I think we've also developed hugely well in terms of the ways of working. We know that great health and care is down to great teamwork, and I've noted how closely together the NHS, all aspects of the NHS, along with our county council services, our district council services, and the services of our third and care sector have come together in partnership and in an integrated way to meet the huge challenges we've had. I think what is particularly noticeable is the deep commitment of the NHS workforce across the county to meeting the needs of the people of Lincolnshire, and I extend that actually because it's equally evident across the local government and wider health and care sector as well. We have such strong partnership working in place in Lincolnshire. We did before the pandemic. The pandemic has strengthened it even further, and now we've got that partnership working as a wonderful asset that we build on going forward. We are all striving to meet the needs of the people of Lincolnshire, and I would also say that in parallel with that, a lot of excellent work's been done in other areas as well. The most notable one, I would say, is the conclusion of the acute services review that was undertaken by the CCG, and the CCG board agreed the outcomes of that when it met in May, following a very extensive public consultation exercise, which in turn had followed a wide range of engagement exercises with the public and their representatives. We know that the 4 services concerned were urgent and emergency care, most notably Grantham A&E, the medical beds model again at Grantham Hospital, stroke care and orthopaedics. And as I say, the CCG board determined the way forward in relation to all of those when it met in May, and we're now in the process of mobilising those outcomes. I would just like to take this opportunity to actually thank all members of the public and their representatives for their engagement in that very comprehensive exercise, consultation exercise. It is very much valued. What everybody contributed, we paid very careful attention to as we worked our way through all the feedback and towards the conclusion of that exercise. Next slide then, please, Steph. I also want to highlight other areas of ongoing good progress. Our work on mental health transformation is recognised nationally. We have a very significant programme going on, which is a partnership programme that is being led by Sarah Connery, who's the Chief Executive of the Lincolnshire Partnership NHS Foundation Trust, but working very closely with colleagues across the broader health and care system. We've also seen the ongoing good development of primary care, and particularly I would say we were in the process of warmly welcoming our dental, pharmacy and optometry colleagues into the NHS integrated care system. Our primary care networks, of which there are 15 across the county, are now very well established, and they are undertaking some fantastic work, I must say, serving their local populations, and they played a lead role in the vaccination programme that went so well. We are recognised as undertaking some important and excellent work in terms of tackling health inequalities. We're recognised nationally as well as regionally for that, but I think it's important to stress that tackling health inequalities remains one of the most significant challenges we face. We've also made good progress in ensuring that safeguarding continues to work really well in keeping the people of Lincolnshire safe. Much of that work is led by colleagues in the County Council, with our teams dovetailing in and supporting exceptionally well. We last year made great progress in terms of health checks for people with learning disabilities and severe mental illness, and again we've exceeded targets in relation to that. And Finally, to note that our partnership with the University of Lincoln is going from strength to strength, and we're working very closely with them, not just on matters such as the medical school or training of healthcare professionals across the county, but also in terms of areas such as use of digital, tackling health inequalities, and developing an academy of clinical excellence here in Lincolnshire. We were delighted to partner with colleagues in local government with regards to the Towns Fund programme. This is no doubt a very sort of leading programme in terms of the development of our towns in Lincoln, Boston, Skegness and Mablethorpe, and the NHS is seen as a particularly strong partner, and I'm delighted to say we're supporting very closely, particularly the Boston and the Mablethorpe and Skegness Connected Coast Towns Fund initiatives, which promise significant improvements for people in those areas, and there's a lot of work currently ongoing there. And finally, to note that the green agenda is hugely important, obviously for the country, for the public sector and for the NHS, and we're continuing to make really good progress on that sustainability and green agenda. Still a long way to go in the service. Next slide, please. Thank you, Steph. Now, this slide was written before our new Secretary of State, Therese Coffey, stood up in the House of Commons last Thursday and talked about her priorities of ABC, of ambulance handovers, backlog, care and doctors and dentists. And I'm delighted to say that all of those priorities of our new Secretary of State are accommodated within what I see as our ongoing challenges. Firstly, I wanted to say that health inequalities and tackling the impact of inequalities on the health of a population in Lincolnshire remains, despite the excellent work underway, a really significant challenge for us. We know we have real issues, particularly out in the coast and in some of our towns, not least Gainsborough, Lincoln, Boston and Grantham. But we also know we have real issues across the more rural areas of the county as well. In terms of urgent and emergency care, this includes ambulance handovers, A&E waits and discharge. And where we are today in Lincolnshire, I think it's fair to say, is in a difficult position in relation to these. Another way, frankly, is that too many people in Lincolnshire are waiting too long for an ambulance. They're waiting too long in A&E, and they're waiting too long for their urgent care, and too many patients are in hospital who are ready to be discharged home. For all of us in Lincolnshire, this is our sort of #1 immediate operational priority, and there's a vast amount of work going on day in, day out in relation to this. Cancer, our teams across the county are making some really good progress across cancer sites, and there's much excellent work going on. The Living with Cancer team, for example, are doing some, I think, absolutely exemplary work. Some of our cancers we do have some challenges over, and waiting, particularly for colorectal cancer, is the most significant one. And again, there's a lot of focused work happening there. Elective operations. Lincolnshire is one of the best performing systems, not just in the Midlands region, but in the country in terms of catching up on elective care. So this is people waiting a long time for their outpatient appointment, or for their elective operation. I'm delighted with the performance that we've been able to put in on behalf of the population of Lincolnshire. We have nobody waiting more than 104 weeks for their care, and that's been the case for a couple of months now, and unless they've chosen to wait longer for that. But we're now pushing on really hard towards the next target of nobody waiting longer than 78 weeks for their care. And again, Lincolnshire's in a strong position in relation to that, but it just shows how much work we've got ahead of us when we're talking about having made good progress in terms of nobody waiting more than 2 years for their care. So by comparison to the rest of the country, Lincolnshire's doing exceptionally well. By comparison to where we were pre-COVID, the situation is still very, very difficult, and patients quite rightly want us to get on as quickly as we can and deliver their elective operation for them. Primary care, so that's GP services, are very well restored in Lincolnshire. By that I mean when you look across all 84 of our general practices, the level of activity compared to before COVID is higher. The number of people who get their care on the day that they contact their general practice is high, and the number of patients who are seen face to face is high as well by comparison to the rest of the country. So there's a lot of good news in primary care. Having said that, we absolutely recognise the challenge that all of our general practices and their teams are under, and how hard they are working to meet the needs of the patients accessing their care. We also recognise that we've got to make sure that we meet the access ambitions that our new Secretary of State has laid out for us. There's some particular issues we need to tackle, both in terms of telephone access, which in many of our practices in Lincolnshire is excellent, but not in all. And we've got to make sure that all patients are seen within 2 weeks. Again, many of our practices are absolutely excellent at that, but not all. So we've got some more work to do to support our hard-working and dedicated primary care teams out there across the whole of the county. Our financial position remains a challenge as well, and sitting across all of our challenges is workforce. We know that in England, as well as in Lincolnshire, we have a challenge in terms of how many of our posts aren't filled on a substantive basis. So that means posts are filled by locum or agency staff, or indeed by they're not filled at all, and that just puts more pressure on the existing workforce. There's a lot of great work going on, again, to try to tackle those challenges, both locally, regionally, nationally. But I think it's right that we just acknowledge that those challenges are ongoing, and generally in Lincolnshire, the further east in our county that you go, the more difficult that those workforce challenges become. Thank you, Steph. In terms of my final comments on the last 18 months, just to note that the NHS was awarded the George Cross Medal just a few months ago, and wasn't that wonderful that we were all able to be part of that. As I say, the commitment and dedication of staff and partners has been exemplary, and I thank everybody for their support. I particularly just like to thank those CCG board members who haven't gone forward into the new Integrated Care Board, and that's Sean Lyons, Jim Connolly, Murray MacDonald, Sue Liebird, Fenella Chambers, Janet Inman, and also Graham Felston. So thank you to them for all of their support and guidance and input under the ICB umbrella. And as I say, it was great that the NHS received the George Cross just earlier in the year. So briefly looking at the current context and forward look. Across the Lincolnshire integrated care system, we have a number of components to this new statutory system of ours. We have the Integrated Care Partnership for Lincolnshire, which is actually meeting tomorrow in public for the first time. And that is where all of the partners across Lincolnshire come together to look at the health needs of the population that we serve and agree a strategy for how those health needs can be best met. We have the Lincolnshire Integrated Care Board, the ICB, which Andrew is the chair of and I'm the chief executive of, that's been in existence since the 1st of July. We've inherited all of the great work and fantastic staff of the Clinical Commissioning Group, but we are on a new mission for Lincolnshire as well. We have the Lincolnshire Health and Care Collaborative, the Provider Collaborative, which is a new collaborative which is developing in the county to enable us to integrate care on the ground in a much more effective way. And of course we have the wide range of statutory and non-statutory partners, the trusts, the GP practices, the county council, the district councils, the third sector, the voluntary sector, the university, who we all work with in an integrated care system in Lincolnshire. The purpose of our integrated care system is set out there in the green boxes: to improve outcomes for population health, to tackle inequalities, to enhance productivity and value for money, and to help the broader social and economic development in the county. And our Steph, the next slide, please. So current context and forward look. I think I probably covered most of this in my previous comments, but clearly it's Secretary of State's ABCD, ambulance handovers, working on the backlog, investing in care, and dealing with some challenges for both our doctors, our GPs, and our dentists. So working across top left to top right. I've already touched on winter and urgent care. We anticipate it's going to be a very difficult winter for the NHS and social care system. We're delighted with the additional investment we've had into Lincolnshire, both from the NHS and from Secretary of State's announcement last week in terms of social care. We're awaiting more details on how we're going to be able to deploy that to the benefit of the people of the county. I've touched on workforce. I haven't particularly touched on digital, but just to say that through the pandemic, we did make a lot of good progress in terms of digital, particularly in terms of access to our services, be that GP services or secondary care services, but we know we've got much further to go on digital. We are looking at transforming and integrating health and care in the county, and fundamentally I see that as a mission to design and to deliver health and care with the people of Lincolnshire, and not to do it for or to the people of Lincolnshire. Then across the bottom line there, continuing to maintain our strong elective catch-up position, tackling cancer. I've mentioned, as I have access to primary care, So that's our GPs, our pharmacists, dentists, and our optical services, and finally addressing health inequalities. These 8 issues, I think, are going to, we can reframe them A, B, C, and D, but these are going to be our absolute priorities for the coming 6 months for sure. Next slide, Steph, please. Just to note that the CCG's annual report and accounts are available through our website. As I mentioned earlier, the CCG also ran from 1st of April to 30th of June this year, prior to the establishment of the ICB, and we're awaiting the timescale for the publication of the annual report, or the shall I say the publishing requirements in relation to those 3 months from NHS England. So Andrew, I shall pause there. Happy to now move to Q&A. I think I'm right in saying, Jules, keep me right, please, that we didn't receive any questions from members of the public prior to the annual public meeting. And I'll look now to see if we have any that have come up in the chat.
Hi John, yeah, just to say that we didn't receive any questions prior to the meeting, and as far as I can see, we've been checking, we haven't had anything during the meeting itself either.
Okay, thank you, Jules. So Andrew, it looks like we haven't had any questions submitted.
Okay. Thank you, John. Do you want to, am I back on live feed then? Thank you very much indeed. So thank you for your report at item 3, and moving then formally to item 4, which is questions from members of the public. And as you have just said, and Jules just said, we've not received any questions, and none have been submitted prior to it via the website or the pro forma. There are no questions, so unless there's any other business, I am going to conclude the meeting. I'd like to thank Jules and Steph for organising the meeting so efficiently. And Jules, could I just turn to you, please, to make sure that people are aware where they can access a record of this meeting, please, if you'd like to just tell us.
Yeah, the meeting's been recorded, and we'll make it available on the ICB website tomorrow. The papers for this meeting were published anyway, but we will also publish John's presentation slides. And if we've then got the ICB public board meeting tomorrow, so if anybody's got any questions, the Q&A facility will be available during that meeting as well, as we will be, majority of us in the room, but it will be held as a live event again, so we can get access to a wider audience. So there's plenty of opportunities, but.
Good. Okay, thank you. So I think it remains for me to thank all the NHS staff who delivered a terrific performance during the 21-22 year, and to the CCG board and committee for all their work, and to thank everybody who has since left for all the work they did. And that therefore concludes the NHS Lincolnshire CCG final annual public meeting. Thank you very much indeed. Meeting closed at 10 minutes past 5. Thank you.